Welcome to the Dr. Francavilla Show. I'm your host, Dr. Carolyn Francavilla, board-certified family physician and diplomate of the American Board of Obesity Medicine. I've been helping patients lose weight to treat and prevent medical problems for the last 10 years, and I'm taking what I've learned from them to you. In this podcast, you will learn the science behind why you struggle with your weight and what to do about it, tips for common challenges, work to fight bias about what a healthy weight really is, and improve your relationship with food and your body. Please remember that while I'm a doctor, I'm not your doctor. This podcast is meant to be informational in nature only, not medical advice. Please seek out care from your physician for your specific needs. Okay, let's get started. Hello and welcome. We have a mini podcast episode for you today. I was talking with our previous guest, Emily Sutton, who is a clinical pharmacist, and we have been talking about the challenges a lot of our patients are having right now with getting their injectable medications, Wegovy, Ozempic, Mounjaro, Saxenda, Victoza, all of these medications that are used for diabetes and or weight loss. And so we wanted to do a miniature episode today to talk about what to do if you're having trouble getting your medication and talk about these quote compounds that have been coming out over the last year and a half or so and what those really are, what some of those risks might be. So we invite you to tune into this episode if you are on these medications, about to start one and worried about the supply. So Emily, thank you for joining me again.
Thank you for having me again. This is definitely something that as a pharmacist is way high on my priority list and radar to make sure that people really understand what's happening in this landscape. And as we just talked about with our previous disease state that we're talking about, understanding that weight loss maintenance is so important. Like, how do we just navigate this without people gaining all of their hard lost weight back? How can we deal with these shortages? It's really difficult right now.
Thank you for emphasizing that, because one of the common challenges I continue to see on social media is people wrapping their heads around the fact that any of the medications we use for weight loss are designed for long-term use. We know that for almost everyone, if they stop the medication, they will slowly regain the vast majority of the weight they have lost back. And so if a medicine is safely working for someone, our goal is to continue that indefinitely. Unfortunately, these newer medications have been so effective and have gotten so much attention that the companies who make them have not been able to keep up with supply. And I don't think that's anyone's fault. So I want to also say that because I think people have made comments about rationing these medications and who deserves them more. And I don't feel like that is my job as a physician to decide. Ultimately, the real issue here is that these medications are incredibly effective and people have been looking for something that works well for a long time. And now we finally have it and people are embracing it. Unfortunately, the supply chain is not keeping up right now. And I think we all keep thinking we're going to turn the corner on this. We're recording this right now in August of 2023. Hopefully, if you're listening to this podcast 6 months or 2 years from now, this is like old news and not an issue anymore, but it has been going on for more than a year at this point, and it may continue to be an issue. Hopefully, if you are listening to this in the future, it is no longer an issue and you can just skip to the next episode. Let's talk about what some of the solutions are if you cannot get your medication. So one of the first solutions I will always try to do is get the next closest medication for my patients. So if someone is on Wegovy, which is semaglutide for weight loss, I may try to get them Ozempic, which is semaglutide for diabetes, but it's the same exact molecule. It's the same drug. It's just packaged differently and the doses are a little different. So that may be one strategy, but unfortunately, a lot of people are using that strategy. So we have shortages of both at times. So then another strategy is using something in the same class. So something similar that's also an injectable medication. But again, we're seeing shortage of a lot of these. So those may not be an option. And then the next option I'll usually give my patients is a different anti-obesity medication, a different weight loss medication that may not be quite as effective, but may help at least with that maintenance. And sometimes I'm even using a combination of different medications in order to try to to get similar effective results. And then we have to go back to some of our other strategies. The really powerful thing about our new medications like Wegovy is that people can often effortlessly just eat less. And when you can no longer rely on the medication to portion control, you may have to be more intentional, but you can use some of our nutritional strategies that we know are really helpful, like bulking up on veggies to stretch out your stomach and getting enough protein to make your self feel satiated, feel full, and stabilize your blood sugar after eating as well. So those are some of the strategies I start with. Emily, as a pharmacist, you're coming from a different perspective. What are some of the strategies you are using for patients who are not able to get their preferred medication?
It's really difficult to, and I think this is a multifactorial issue when you say not able to get their medicine, right? Because at this day, on this time, that can look like, did my insurance change? And I can't afford.
Right. It's not always about shortages, right? Sometimes that
right.
prescription has run out, insurance has changed their policy.
Right.
There's a
Yes.
lot of reasons why someone may not be able to get their medication.
And including right now this era of shortages, which I'm sure anybody that has ever taken any drug in just about in the last year or two, like the amount of shortages and the just breadth of different shortages across so many different disease states has been unprecedented. And it has created such a mess for everybody, people that have been stable on so many different things and just can't get it anymore. And that's very disheartening. And for our patients that have our anti-obesity medicines have just worked well, and maybe for the first time in their life, they feel like they have some control over what's happening with what's going in their body. It is so defeating to not be able to do that, and very scary. And I think for a lot of people, and I bet you've seen this before, people may have lost a little bit of trust in their own ability to regulate their intake. And that's really scary when you know that you had such a great response to a medication and you just don't have that confidence in yourself to think it's just being ripped away. And I follow a very similar pathway. We try to do the same thing, or same class medication. And of course, as insurances are changing daily, it becomes more and more difficult to do anything if it's not following the strict letter of what insurances dictate, and if they even allow for any of that. And it seems every day this that was in stock is now not in stock. So what's this? And then we've got people calling pharmacies all over, like within 200-mile radius.
Right,
You know,
right. A little proactive, and if it's a shortage issue, call around and unfortunately
right.
see if they can find it somewhere else, which sometimes works and sometimes does not.
And I think a lot of it too is setting fair expectations and reminding people too that, like, we do have these other medications. It may not be what is on social media, it's not what's being bombarded to you, but we do have other medicines that are safe, that are effective, and that if you want to use it, as long as you're losing weight, you're doing a good job. And if you want to wait until you plateau, if you want to wait till things come back in, that's an option. There are lots of options. And it's important to continue to look at this as a weight loss journey, not a sprint. It's the marathon. And when we continue to look at it as a journey that you want to walk on with the best support that you have, it may be more reasonable to wait a couple of months and see what the landscape looks like at that time. Or if you're like, I just need to get started, I'm ready, I'm motivated, and if I don't do it now, I'm never going to do it. And then maybe find another one of those options that's been pretty reliably
Right. So maybe even right now, if you're thinking of starting a medicine, know that as of right now, August 2023, this may not be the time to start one of the newer injectable medications because you may not have a reliable supply, and that may be really frustrating, but that doesn't mean do nothing. You may start with something else. And one of my patients that I think of, who is one of my sort of like biggest successes right now, she came in and we were able to start her on Mounjaro or tirzepatide, and she did not like that medication. She had side effects. She didn't like it. So we went back and we just used generic phentermine, which has been the bread and butter of what I've prescribed for most of my career. And she has done phenomenal. She's actually to a normal BMI. She's training to run a half marathon. She's just like a poster child. And some of these old medications, some people are just tremendous responders to. It may even make sense to start with one of these generic, cheap medications right now, because if it works for you, great. You have something that's a lot easier and cheaper to get. And if that does not work for you, then we can escalate to these more expensive, harder to get medications. We are seeing a resurgence of using these sort of generic medications, and If you want to learn more about those medication options, I do have a podcast episode with our Obesity Medicine Association president, Angela Fitch. I think it's episode 8. It's fantastic. So highly recommend checking that episode out so you can learn about all the different medication options. Alternative options, which may be temporizing while you're off of it, using nutrition strategies, switching to a similar medication. So these are all things you may need to navigate with your prescribing team to figure things out. And then I always tell people, if you know that medicine worked really well for you and you just can't get it right now for some reason, to have hope, because I think these medications are only going to get easier to use. We have more powerful ones on the horizon, which hopefully will make it easier and easier to get these medications as we have more options. Hopefully we'll start to bring down the price as we have more and more powerful options as well. But my crystal ball has not been working really great on predicting what's going to happen with these medications. I try to offer that hope that if you have found something that works, I think you're going to be able to access it again in the future. And so sometimes that's just nice to know something is there waiting for you.
Exactly. And again, it's the journey. It's a long-term process. And ultimately, the fact that you're making progress, any progress, is better than no progress. And just like we talked about,
that we haven't talked about, Emily, that I have found myself also directing patients towards is, if you did find that Wegovy or one of these injectable medications worked really well for you and your insurance is no longer covering it, or you're having trouble accessing it for other reasons, that this may be the time to consider metabolic and bariatric surgery if you haven't done that, because likely you're going to be a really good responder. Those surgeries work on similar hormones. And now you've really seen that this is a biologic thing, and that fighting it with the biology of the medicine was really powerful, and fighting it with the biology of surgery may also be really powerful for you as well. So that would be another thing to consider, is maybe now this is the time to have a consult with a surgeon.
And I think a lot of people in their brain, when they think surgery, oh my gosh, surgery, that's so extreme. And I know this as well, that in the 10 years that I've been doing this, what outcomes we've seen from bariatric surgery have every year, there's something new that's being presented that bariatric surgery dramatically improves. For a long time, we didn't have those long-term outcomes, and we knew what the weight loss was associated with and how long that weight stayed off, but we didn't always have the really solid outcomes. Yes, it helps decrease fatty liver disease. Yes, it helps women have safer pregnancies. Yes, it helps decrease heart failure. There are so many things that continue to come out. That
our data for surgery is really compelling. It resolves most of the health problems related to weight for most people. And it's, when done by a surgeon who that's all they do, is a really safe intervention when it comes to surgery. So it may be time to have that consultation and consider that too, if you're feeling like you are never going to get this medicine again and you don't want to undo the work you've done, or you've seen the huge improvement it's made in your health. Okay, so we promised we were going to talk about the quote compounds. If you're watching me on a screen, I'm doing my air quotes here because I don't really think that is the best terminology for what we're seeing personally. We have a pharmacist with us who probably is the best person to talk about this. Just generally speaking, briefly, what is a compound medication and why do they exist?
Yes, compounds are there typically by law for things that don't exist in a commercially manufactured manner. And for example, if somebody could not swallow a pill, and that's the only way that it was commercially manufactured, is in a pill formulation or a capsule formulation, it is allowed by law to be compounded if that person cannot access that. And so typically through the years, people have gotten access to compounded medications when it's been in some formulation that is not commercially made. And that is,
we had this document that we wrote from the Obesity Medicine Association. I didn't help write it, but I approved it as being on the board. And we talk about some of the reason compounds exist generally, right? Like you said, to customize the way the drug is delivered, right? So if it only comes in a pill or a capsule and we have someone who can't swallow, or a child, it might be compounded, made into a liquid at a special compounding pharmacy. You need to customize the drug dose. Same thing, compounding pharmacy can do that. If we need a pure form of it, maybe the way that it is available, the way it's manufactured has a dye or an additive in it that a patient can tolerate, then the compounding process might be able to do it in a pure form where that is not there. There's lots of reasons why compounds exist and have been safely used for lots of medical conditions for a really long time. I use compounds for various conditions in my family medicine clinic. That being said, there are a lot of advertisements. You really can't escape people talking about compounded peptides, compounded semaglutide, compounded tirzepatide right now. And I tell my patients that I don't think compounded is really the right word, because essentially what these companies are doing is they're just doing a copycat, right? They are taking something that is FDA approved and regulated, and they're just making their own version of this. So it's, you have your Louis Vuitton or your Coach bag, and then you can get your knockoff that may look the same. But if you've ever bought one of those knockoffs, it does not wear the same. It is not the same thing. So I personally think of them more as knockoffs. That's my perception of this, because they're really not FDA regulated. They're just copying a drug that currently exists. What, as a pharmacist, is that take right? Am I explaining this correctly?
Yes. Like when you're thinking about a lot of other compounded medications, that is not necessarily true. But in this realm, it is true, because there is, as we've talked about, these unprecedented shortages, and the FDA made a special exception in this case of unprecedented shortages, that they won't call these things illegal. But I think it's really,
the FDA did put out a warning a couple months ago saying you should be cautious with these. And so
we're not going to say it's okay. We won't maybe
down on this. So if you're looking at that as a solution to your supply, I don't think the supply of these is guaranteed either, because the FDA may crack down on this, states may crack down on this. The companies making these may get sued by the drug companies that make the legal FDA approved version of this. So it's not really, I don't think it's a reliable supply long term either, as well as the fact that we really don't always know what's in these. They're
exactly. And in the pharmacy compounding world, there are two different types of compounding. There's non-sterile compounding and sterile compounding. Your non-sterile compounds are like lotions, pills, things that are not going to be injected into your body and have to be created very sterilely. The sterile compounds are going to be things like injections, and particularly these types of injections. And it is very tightly regulated by the FDA. They have very strict rules in place on what makes a sterile compound. And so typically, when you're looking at a sterile compounded product, which would be an injection, it is typically very expensive, because in the correct environment, each batch is tested for sterility. It's tested to make sure it's sterile. There are no different bacteria or fungi or anything growing in each batch. They are very tightly controlled on how long you can use them. And it is incredibly strict, because they've had bad outcomes before in less tightly regulated environments for injections. And so it is very tightly regulated. And that is only a part of it, to say, did it actually, like what I'm looking into, what someone is offering me, the first question I always want to know is, did it come from a sterile compounding facility, which they should know. And if they did come from a sterile compounding facility, they should be able to provide the information on, was this tested? Was this batch tested for sterility? What were the results? All of that should at least be able to say, at least I know I'm not going to get a terrible infection from a not sterile injection. So that's the first thing. And then how we talked about, just, I'm not sure what the supply line is going to look like. To be clear, like the manufacturers of the medications that are being knockoffs are the sole proprietors of that drug molecule. And they are not giving it to these compounding pharmacies. That is not like manufacturer approved semaglutide. That is not manufacturer approved tirzepatide. That is maybe semaglutide, maybe tirzepatide, that is obtained from another country, typically China or India. And they are typically maybe or maybe not in an FDA inspected or approved facility. If they are not in an FDA approved or inspected facility, again, like we don't have any way to know that is actually what it is, and that it is actually in the concentration that it says it is, and that it is still sterile. So those are some of the biggest issues that we can see is, I don't know what it is. And of course, you've heard good stories. I've heard good stories about somebody that got it compounded and has done great, you know.
Yeah. If someone is feeling really frustrated because they have found this life-changing medication and for whatever reason, they are not able to access it, cost, supply, availability, all these things, and they are seriously considering using one of these quote compounded versions, what are things that they could do to make it the most safe possible experience?
Yeah. So it's important to remember these sterility dates. Like they should get something from whoever made this that tells them how long it's good for, what all ingredients are in there. They should be able to get the data on the stability and the sterility from the batch testing. They should also, if they wanted to, be able to inquire as to where the raw product came from. And if they are okay with that, then that's okay. But just to know, like, it is not just regular generic manufacturer approved semaglutide. It's not.
Right. There's no
So
generic version of those
right,
readily available. So if you have taken, say, a compounded naltrexone or a
right,
compounded nifedipine cream, which I prescribe for anal fissures on a regular
yes,
basis, if you've taken something like that, is a FDA approved generic regulated substance that the compounding pharmacy has made into the substance that your doctor has recommended. In this case, that is not the process that's going on. So there's definitely a higher amount of risk going on, and
right,
maybe variation from place to place where you're getting it as well, doing as much due diligence as you can. The substance that you're getting should
right.
have an expiration date on it.
Mhm.
You should be able to get information about the sterility. This is someone who's making a fake substance, so they could
Right.
probably fake a lot of the other information that's going with it.
They could. And ultimately, too, asking those questions is important. Understanding, too, what you're getting. If you're paying $100 for a vial, that is not a sterile compounding pharmacy would be hundreds of dollars. And typically, a compounded injection is not good for more than 28 days once you've made that initial puncture through. And it would be really unlikely that anybody would assign a larger time of use for it. So even if you store it in the refrigerator, if they say it's 28 days, don't try to save money and order a double dose so you can do half the dose and make it last 2 months or 3 months, because that should not be sterile for longer than 28 days. And making sure that you're getting it from what seems to be a reputable pharmacy. If it's just like a name of something, that's probably not a reputable pharmacy. If you look on their website and see that they follow USP 800, which is sterile compounding rules, if you see that they've been in business for a really long time doing sterile compounding, that would be some reassurance. But very few pharmacies are actually set up and certified for sterile compounding. So that would be very difficult to find and very expensive. But you can ask all those questions. Where do you get the raw product? Are you an FDA inspected sterile compounding facility? What do you have the batch information, the sterility testing, the stability testing? And if they have added something, because sometimes what some of the people have been doing is adding an ingredient like B12, and that says it's not the same thing. So it says a compound and it makes it unique, right? But also, have they tested? Because that has not been tested in commercially. So it's not, so have they tested the stability of adding B12 to this compound or to this drug ingredient that had not been tested? And if they're using something different as a solution, has that been tested? Are they, truly testing these things in the diligent manner they should be? And at least then you know what you're getting. And if you wanted to call around and find places that can answer these questions to your satisfaction, at least you know what you're getting. If you make the decision to go ahead with it and proceed, at least that's what you're getting.
And I would leave with one final thought, which is the whole reason that I help people lose weight is for health. And
Right.
I would encourage anyone listening and thinking about any sort of substance they're going to use, is this more likely to improve your health or not? And so
Right.
just like I would never recommend our anti-obesity medications for someone who was a normal weight and wanted to lose 5 pounds for a beach
Right.
trip, that's not what these medications are
Mm.
for, because there's risks with all medicine. And so if there is not a likely medical benefit to taking something, like, we shouldn't do it. And so we always have to individually weigh, but your prescribing team is also weighing this for you to some degree. What is the risk benefit here? And before you jump into any of these options, you need to consider that for yourself, because there's going to be risks with even the FDA approved prescription medications. There's risks. And any of these things should be used to improve your health. And if they're not, if you're having terrible side effects or there's not a compelling reason this is going to help your health, then that may not be the thing that it makes most sense for you to invest your time, money, and risk into.
And again, hopefully these drug shortages will resolve soon where this won't even be an issue. That would be the ideal situation.
It can only get better. It can only get better is what I tell my patients. That being said, my crystal ball has not been working that great this year.
And we understand how much people want access to these medicines. And sometimes it seems like that may be the only way to go about it. It is a real issue to make sure you're doing it safely and as an informed consumer to make sure that you're asking the correct questions and not just ordering it from some random thing off social media, because they do have real risk and they need to be discussed at length. And just being able to order it without a medical provider's input is dangerous and not advised, even though we know there's lots of bias. A lot of providers may not be comfortable prescribing them, but somebody will. Like, you can find a empathetic, and really to go that route is only a last option, and hopefully no one will need it, but please be an informed person while you're doing it.
Well, Emily, thank you so much for sticking around and doing a second episode with me about this really important and timely topic. And
yes. Well, hopefully we will, in 2 months, we'll just laugh about this.
Yeah, hopefully we're like, oh, what a waste of time to have made this episode. There's always going to be challenges that come up, even when the supply chain stabilizes, insurances change, budgets change, or people have a side effect to a medication and they need to change to something. Knowing what those options are, I think really are important before people go into something, or if someone's worrying, people have had success on a medication and they're a little bit of a worrier, and what's going to come next? What happens if I can't get this medicine? So hopefully we put some ideas out there that there are other nutrition strategies that can complement medications. There are other effective medications. There are more medications on the horizon. Things are getting better. And then some of the risks that can go along with these so-called compounded peptides.
Yes. And for better or for worse, we do have a strict FDA approval process, and that protects us. Sometimes it seems a little long and onerous, but it's there for protection.
I love it. What better way to end? Okay, until next week, take care.
Thanks. Bye-bye.
Thank you for listening to the Dr. Francavilla Show, where we learn about all things related to weight and health. If you love this podcast, make sure to leave those 5-star reviews and share this podcast with a friend or loved one. If you have a topic about weight and health you want me to tackle, head over to the website, thedrfrancavillashow.com, to submit your question. And make sure to subscribe to the podcast so you don't miss next week's episode. Take care.